Good morning, everyone. If you'd please join me and rise for the Pledge of Allegiance. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, what's my first hearing?
58 right now.
58?
58.
I hereby open the public hearing on Senate Bill 58 and call the prime sponsor to introduce it. You'll have to excuse me, I'm short a clerk today, so.
Good morning. My name is James Gray. I represent Senate District 6, and I'm here to introduce Senate Bill 58. Senate Bill 58 has a very long past, unfortunately. We introduced the bill many years ago. We started off with the state hospital. I had a constituent of mine that was injured quite severely in the state hospital. She was working there, out for many weeks. We made some changes to the state hospital. The Hospital Association came to us a year or so later and says, well, we need some help also. Where are we now? Last information that I got was that there were 50 assaults in medical institutions here in January. 50. Why do I care? Well, we had a guard at the Rochester facility, Frisbee Memorial Hospital, who's killed. This was subject of a committee. Committee said, well, do this, do this, do this. The first few things had to do with escalation and de-escalation techniques. That was also packaged with some of the language similar to what you see here. When it came over to the House, it says, well, gee, that would be two different committees. We don't want to deal with that. Because of time, they stripped out the portion that you see here, past the de-escalation techniques, etc. And now we're back again. In the Senate, because of press that we received about putting this into the warrantless arrest statute, we went and looked for a different place to put it. Legislature a long time ago recognized that certain merchants and movie theater people deserve some special consideration. We believe that the people that working in the hospitals where a patient comes in as a life-threatening situation, they can't just walk away from a patient, whether that patient is belligerent or not. So in here, and the hospitals aren't in full support of putting it in here instead of and I'm sure that they will say that unless they've changed their mind, and I don't believe they have. But this gives them the right to detain the people. This gives the officer, based on the evidence that he sees when he gets there, to do certain things, just as if a person is taking things at a store or recording a movie at a movie theater, they can do that same kind of thing. It's very limited in what they can do. Many of these, because the people will either be have mental health issues, or they will be suffering from drugs, or they will be any number of conditions. These things will probably never get prosecuted. But we need to resolve the situation. We need our healthcare workers to be able to work, going to work and coming home from work every day without being assaulted. So we appreciate consideration of the bill. I believe it is a good bill. It will serve the state of New Hampshire well. Thank you.
Any questions for the senator?
Representative, I can't forget his name. Muse.
Yes. Thank you. It has been a week. Um, but one of the things that I'm curious about, Senator, are how these incidents evolve in hospitals. So you've testified that there are 50 assaults. What's happening? What's going on in our hospitals that's basically leading to hospitals becoming places of violence?
I can tell you that in the testimony that before the committee and the commission, a lot of it had to do with, as I said, mental health issues and or drug-related issues. Okay, and again, if the person does not, and I'm going to put air quotes around this, require the treatment, they can ask the person to leave. Okay, and if they don't leave, the police can come in and arrest them. The problem comes in is when they've got a life-threatening condition that the hospital has to treat. And they're caught between a rock and a hard place. Somebody who says, I'm going to stab you, I'm going to hit you, I'm going to whatever. But they can't walk away from that person. 50 assaults in January is what I was told. And personally, I believe that there's a lot of minor assaults that go unreported.
See no further questions. Thank you, Senator.
Thank you. Now.
And the chair calls Senator Cindy Rosenwald.
Thank you very much, Mr. Chairman. For the record, I'm Cindy Rosenwald. I represent Senate District 13, which is much of Nashua. And I have longer written testimony, which you all have, so I'm not going to read it. But I'm here as a co-sponsor of this bill to ask you to please reject it in its current form and return it to the thoughtful compromise approach that was worked on for much of last year and agreed to by a disparate group of stakeholders. This disparate group of stakeholders that came together to agree on language included NAMI, the Disability Rights Center, law enforcement, the ACLU, and the hospitals. The reason all of these groups agreed on the original language of Senate Bill 58 was that it provided clarity to law enforcement around their ability to execute a warrantless arrest for a potential misdemeanor for violence in certain healthcare settings, but importantly did so without criminalizing mental illness. Unfortunately, the Senate-passed version of this bill will further criminalize mental illness by removing important limitations in current law, therefore broadening the potential for someone suffering from mental illness to be arrested. These are patients seeking health care, but the bill will make it more likely they'll end up in jail and definitely not get treatment for their illness. There have also, subsequent to the Senate actions on this bill, been questions raised as to whether the detainment and restraint of patients would violate standards of the Centers for Medicare and Medicaid Services and risk a hospital's certification and funding from these important payers. For all these reasons, I ask the committee not to pass the bill in its current form, but to consider adopting the original version with the clarifying language around medical necessity that I've attached to my letter to you all. And I thank you for the opportunity to be here. I'm happy to answer questions.
Thank you, Senator. Could you tell us what the impetus was for the big flip? What caused that change?
I think there were, well, I'm guessing, hearsay. There was a senator who didn't like it, and then things snowballed from there. Last year, this original version was passed unanimously by the Senate and sent over to the House, whereas Senator Gray said it got carved out of something else that was passed. So I was not privy to those discussions, but I was part of the negotiating group that came to this agreement among all these different stakeholders.
Thank you. Any further questions for the senator? Representative Newman.
I just have a question about the the amendment. What effect will it have on the bill that we have in front of us as amended? I see it amends it amends a law, and that particular paragraph C is not in the amended version of the Senate. I'm just wondering how that all will work together.
So it would not, but if you were to adopt as an amendment the original language of Senate Bill 58 as introduced this year, I would ask you to include this amendment, which changes just one small part, to make it clear that it's not law enforcement who would be determining what medical treatment is necessary, but it would be the judgment of the licensed healthcare professional.
Thank you.
Seeing no further questions.
Thank you very
Senator.
much.
Chair calls Margaret Brew, I'm sorry. Yeah, I hate that. I like this better. I think so.
Good morning. My name is Margaret W. Brew. I am a registered nurse. I'm testifying in support of this bill. The provision for warrantless arrest was removed from Senate Bill 459 FN. This decision afforded the opportunity for the bill to pass and be signed by Governor Sununu on July 22nd of 2022. In removing it, it negated an opportunity to effectively support healthcare employees who are impacted by workplace violence. In an article by Chapin and Collar in 2022, in healthcare or social service settings, workplace violence affects and involves employees, clients, patients, customers, consumers, and visitors. Workplace violence costs the United States $151 billion per year, with an average of $250,000 per incident. These figures do not capture the hidden costs of workplace violence. Those are emotional pain, depression, isolation, and anxiety. In turn, this has a direct impact on the ability of the healthcare organization to meet patient needs and industry accreditation standards. It directly impacts the fiscal stability of the state of New Hampshire's healthcare industry. The following events that occurred in New Hampshire hospital facilities are cited. Hospital security guards were summoned to the intensive care unit by an RN to remove family members who were physically fighting. The fight was about which daughter was going to get their dying mother's jewelry. One guard was injured by the family members and required emergency department care. Their supervisor cited that injury is, quote, part of the job. The injured guard returned to work until being harmed again and then resigned. An intensive care nurse was threatened by a patient who stated that upon discharge, they would search out the nurse and kill them. The patient had threatened to harm emergency department staff during prior admissions. No reports were filed by the emergency department staff as they believed nothing would change. When the RN reported the event, it was dismissed as hearsay as there were no witnesses to the event. The RN resigned. A surgeon performing a technically challenging procedure at a patient's bedside. The surgeon became enraged due to a malfunctioning surgical instrument. The surgeon threw the blood-covered instrument at the RN assisting the procedure. The patient had hepatitis B and AIDS. The nurse reported the event to the unit manager, and the manager said, "Well, it's a good thing that you ducked." The surgeon was not addressed about his actions in the event. The RN resigned. The staff involved in these situations perceived there was no recourse other than resignation due to the harmful situations they were involved in. The organization did not support the employee nor effectively address the situation. Warrantless arrests would be integrated into the organization's comprehensive workplace violence management plan. Effectively applying the warrantless arrest law would afford the healthcare system the ability to support those who are affected by violence. Workplace safety is inextricably connected to patient safety and directly affects patient outcomes. Workplace violence has a direct effect on employee engagement, morale, recruitment, and retention of staff. Violence negatively affects the socioeconomics of all New Hampshire communities. The passing of Senate Bill 58 will positively impact those affected by violence in the healthcare industry. Thank you.
I don't see, oh, yep, Representative, go ahead. Selig.
Thank you very much. I just want to clarify, it seems that part of your testimony was about assault by a surgeon against a nurse. But the bill talks about people in the care of the medical professionals, not the people performing the medical procedures. And so just wondering, maybe I'm misunderstanding, but I don't see how this would address that particular circumstance.
My point was that we are not only looking, the concern we have, and I have specifically, is that we're somehow trying to pin bad behavior on the mentally ill. It isn't. That's why I use that example. The bad behavior is across the board. It is visitors, it is family, it is co-workers. Whether or not they have a specific diagnosis, these are the people. We're harming each other in the profession. The families are coming in and harming us. So my example is that warrantless arrest is not just about arresting the mentally ill or arresting the patients. We need to be considerate of the whole circumstance that promotes violence in healthcare, and we need to be concerned about all aspects of it.
Thank you.
Representative Rhodes.
Thank you, Mr. Chairman. Thank you for taking my question. So did the hospital have the option to take some kind of disciplinary action and they just chose not to?
Yes.
Okay.
Seeing no further questions, thank you very much for your
Thank you.
testimony. Chair recognizes Mark Grossman.
Hello, I'm Mark Grossman. I'm an emergency physician. I hate to say it, over 20 years of experience in emergency medicine. And I currently work at the Portsmouth Regional Hospital and some other hospitals in New Hampshire. I've been in New Hampshire since 2018. I came from Florida. And what I'll tell you is that the importance of healthcare worker safety is, I would say, taken more seriously in Florida, where I was assaulted by a patient and I called the police and they came, interviewed me, interviewed witnesses, and they removed the patient immediately. And I was surprised and disappointed when I moved up here that the same safety is not afforded to us in the state. And I was a victim of an assault while I was up here, and the police came and they said first that, well, we didn't see it, so we can't do anything, despite the fact that there are videotapes and witnesses. And then another time when there was an assault and the police were there, I said, well, you've seen it now. Can you arrest them? And they said, no, because deadly force wasn't used. So I think there's several aspects to this. One of them is that the laws don't really protect the healthcare worker. And what they tell us is, well, it's only a misdemeanor, so if we remove them, we still would have to bring them back to be cleared once we bring them to jail, so we bring them back to the emergency room. The other thing that happens is the police will sort of victim shame and say, are you sure you want to testify in front of a jury that you've been assaulted and you have to give your home address and things like that? And I've seen this happen. I've seen it across different jurisdictions. And it's very disheartening to hear that and to have people discouraged from pressing charges and from testifying, not even given the chance. And what I believe this bill will do is give us some peace of mind that when we come to work, if we do get assaulted, and it's not a mental health issue. I mean, there are patients with mental health issues that are involved with this, but I see it more often than not, non-mental health cases. Sometimes it's people who are desperate and have nothing to lose, people who are addicted to drugs, people that are expecting something that they're not getting, and sometimes it's people that are alcoholic. But sometimes, especially post-pandemic, it's people that are just enraged with the waits in the emergency department, waiting to go upstairs to get a bed, overcrowding, and just a lack of staff. So they have to wait for lab results or CAT scan results, or how come you're not taking care of my mother? And they will get very upset and will get physically violent. We're protected by security guards, not by police who are armed and sworn officers. And those security guards don't have a sworn duty to act. If they sense a danger, they may try to help and intervene. If they're overpowered, they will step back and call for the police. And we have to wait for the police to come. I truly believe that we need to strengthen the protections of healthcare workers. We're having problems with recruitment, retention of healthcare workers, because they know that if they come to New Hampshire to work, they aren't protected. And I've spoken to people that have left the state of New Hampshire to go work in other states where they are protected after they have been assaulted or if they've been a witness to an assault. And this is very concerning, and I'm very hopeful that this bill will help strengthen our protections and keep us safer in the emergency department. I want to remind everybody that 3 years ago, we were celebrating healthcare workers as heroes for staying and taking care of patients that were communicable and ill and putting our own lives at risk. And we still put our own lives at risk every single day. And this is one bill that will help so we don't have to worry about at least this aspect of our work.
Representative Muse.
Thank you for taking my question. I just wanted to drill into your statement that healthcare workers are unprotected in New Hampshire. My understanding is healthcare workers are protected by the same laws against assault that the rest of us are are protected by. So what I'm not understanding is how um, is exactly, you know, how or why you think that hospital workers are less protected. And I guess the other thing I'm struggling to understand is if there is an issue with violence in hospital settings, has hospital administration actually had conversations with local police departments about responses and maybe treating incidents at hospitals a little bit differently?
Sure. So keep in mind that a hospital, especially an emergency room, has a different clientele and a different sense of acuity than a local diner or any other business. And we're dealing with people that are sick and that are frustrated, and they're concentrated in one place. So the violence is probably more likely because there are volatile situations every day, and there are disagreements about treatment, and people come in and after having consulted Google, they expect that the treatment is going to be X, Y, and Z. And when they're not getting X, Y, and Z, they may get upset. And I see this every day, every single shift. And once again, post-pandemic, they can't get in to see their primary care doctor. Their surgery has been postponed. Some people have lost their insurance because they're not working or they're underemployed. So they get frustrated because they can't afford their medication, or they come in sicker because they can't follow up with primary care and they've lost access to care. In regards to your second query, we meet with the police on a regular basis. The police aren't staffed to protect our department. They will prioritize a response to the emergency room, to a call for help. And as we all know from watching TV, some of these events may be over in seconds or minutes. By the time they get there, even if they have a 5-minute response, which would be great, the incident may be completed, whatever that is. So we'll try to deal with it the best we can. And without the police presence, and once they arrive, it makes it easier. Now, again, once the police do get there, if we have this volatile situation where somebody has tried to attack us and the police can't then remove the patient, the volatility remains. And that's sort of answer 2B to your question. You didn't really ask that question, but that's where this law would help protect us. So once they do respond, they can't really do anything right now. They will say it's a misdemeanor, they didn't witness it, and they won't remove the person in question, the assailant. And that's what we really need them to do. It's not criminalizing mental health, by the way. It's simply protecting us.
Could you, from a practical standpoint, you're treating someone in the hospital for whatever injury. He becomes violent, disruptive. The police come, this law is passed, he can be arrested, but the treatment has to continue somewhere. Can you walk us through what would that look like? They can't take him away because he has to be treated. I'm inferring from what you said earlier that they would just take them right away. Where would they bring them?
So that's that would be honestly on a case-by-case basis. If it's a family member, for example, somebody that's not seeking treatment, they just happen to be on campus, obviously they can be taken away without delay. If it's somebody that needs to be admitted to the hospital or is being treated and needs to be in the emergency department for that treatment for X number of hours, I would say that either the police would stay there and they would have them in custody and remove them once they're cleared medically, or they would have to come back, or the deputy sheriff would come or something along those lines from corrections, and they would still be in custody while being treated.
As a follow-up, and if they're admitted?
It's the same. We've had prisoners who are admitted to the hospital and they have a guard that's staying with them just to make sure that everybody is safe, including the patient. And I agree, the patient may be vulnerable as well. and they do deserve treatment. And I'm not saying that they don't deserve treatment. If they can be cleared and removed and it's safe, then I would advocate for that. If not, then we still need our protection. And what I've seen in other states that I've worked in over the years, that if they're arrested, they get arraigned or whatever it is, then corrections will stay with them, a corrections officer or a sheriff's deputy in the state.
Thank you. Representative Mangiapudi?
Thank you, Mr. Chair. Thank you, Doctor, for taking my question. I have two-part questions. One is you describe the whole scenario, workforce shortage, not just at the hospital, at the police, at, entire community in different forms. That's affecting the response, the emergency crisis response. And how does this impact if the communities have mobile crisis units? And has that alleviated some of the flashpoints at the emergency room if the crisis is intervened before the patient or before the person gets to the emergency room, deflated?
Of course, and I'm actually a huge proponent of this, although I don't believe it's completely rolled out in the state. It's something that's relatively new. I'm excited to see it, and I think the de-escalation of these cases before they come to the emergency department is vital, and it's been effective. And I think our psychiatric holds in the emergency department are down, but they're still there. And I don't think every community is as well served as they deserve to be within the state of New Hampshire. But again, this is something that I believe is a work in progress, and I'm looking forward to its full implementation.
Thank you. So there are tools that's available but not completely implemented. So from your perspective as a provider, this is another tool in the toolbox to de-escalate and provide a safe environment for everybody, the provider, patient, family, everybody.
Yes,
Is that correct?
I agree, because the emergency department probably isn't the best place for somebody who's having a mental health crisis. And again, I want to reiterate that that's not necessarily the patients I'm talking about that are perpetrating these assaults. But they may trigger other people. So if they're in the hallway waiting and they sort of start getting agitated, frustrated, what have you, that may, and I've seen this, it becomes sort of a domino effect where other people around them get frustrated and upset, and they see, well, this person's getting so much attention and I'm not. So I've seen that as well. But again, to answer your question, I believe that this is something that will benefit us, benefit everybody in the end.
Representative Prue?
So I'm sitting here wondering, and I hear it's because it's only a misdemeanor, they can't do anything. So in my head, I'm thinking we need to raise the level of this assault on a healthcare worker so that they can do something. If it goes up to a felony, then they can take them. Or
And
act
that would
appropriately.
mirror other states' laws.
Yeah. Just for clarity, I'm an EMT, work for a fire department. One of my crews was just involved in the melee at a hospital and almost got his nose broken while trying to protect a nurse from someone who was intoxicated. So I'm well aware. And I do believe we need to do something and not just a little feel-good thing, something that actually protects our healthcare workers. So do you think we should raise this, is my question, because I know he was going to ask if there was a question in there.
I think that whatever laws need to change. I can't tell you what the penalties should be or what the category of crime, whether it's felonious or misdemeanor. But I think whatever it needs to be to have these assailants removed, that's how you should define it. I can't say again whether it's a felony or a misdemeanor, but it should be
I
the
understand.
level that somebody is removed.
Yep, I got that.
Thank you for your testimony, Doctor. Oh, Representative Reed's here. Okay.
Thank you, Mr. Chairman. Thank you for taking my question. As far as healthcare, the hospital administrators, do you find that they sometimes are a roadblock to calling for police help? And if they do frown on that and make it, something they don't encourage, do you think that something should be added as a protection against for healthcare workers who have called the police?
I don't believe so. At my hospital, our administration has been very supportive of protecting us. Again, they have no role in the enforcement of the laws. But they would never say to us, well, don't call the police or don't testify or don't press charges, because it's in their best interest to keep their workers safe and keep the patients safe and keep it a healthy working environment.
Thank you.
Also, one of my administrators is right behind me, so act natural.
Nice answer then.
Thank you for your time.
Thank you, Doctor. The chair recognizes Josh Henry. Jason.
Good morning, everybody. Jason Henry, Superintendent of Rockingham County Jail. So I'm just going to give you I want to give you the end result if a bill like this goes into effect. So I agree, healthcare workers getting assaulted is horrible. I have healthcare workers inside my own jail that get assaulted. It is difficult. I have over 50% of my inmates are on some sort of psychotropic medication. The rate of violence has gone up tremendously over the past couple of years. We have seen more in-house psychiatric patients that have been charged with some sort of assault. I have people that are IEA status, voluntary, emergency admissions sitting inside of my jail because they're a mental health crisis and severe mental health crisis and may have assaulted a staff member at one of the hospitals, and they send to jail. Now, at the jail, we're not equipped to do 4-point restraints. We cannot forcibly do medication. I am concrete and steel, and it's not a place for somebody that's in mental health. So I think a couple of things in this law. One, I hear somebody who's not in mental health distress or crisis. I get that. That's the person you arrest. And I agree that there is laws about there for being assaulted. If you want to enhance the penalties, maybe on the first responders and the workers at the hospital, that might make sense. But the laws are out there for if you're assaulted. I am very concerned about those in mental health crisis. I testified in this bill in 2021 when it came out, again, the end result. If somebody's in mental health crisis, why are we sending to the jail? In turn, when they get to us, they need a higher level of care than the jail can give. Now, we have some medical staff and those kinds of things, but in turn, we bring them back to the jail, to the hospital, the same place they probably assaulted somebody, and they're very angry with us because we brought them back. And just because I have an officer there doesn't necessarily mean that they're going to be able to stop another assault. They're there in proximity because they still have to stay out of the way because the person's getting care. So that does not solve this issue. Okay, they're still going to get charged either way. So you're bringing them, somebody who's in the middle of getting care, to a jail to bring back to get care. Okay, so we're interrupting the care. So I think that's counterproductive of what we're trying to do. Again, mental health crisis, somebody that's actually in mental health crisis. So I think we need to separate the two somehow, some way, because there's a big difference with there. I'm trying to think of so I also heard out here, congregate settings, basically. You have shelters that have the same issue, a bunch of people that are angry and stuff like that, and they get assaulted. Do you take this to the next level and they also get a higher level if they're assaulted? I understand hospitals they're not equipped to keep these people there. Neither are the jails. But the state of New Hampshire has been in a fight back and forth and has been determined that something needs to be done for the mental illness. And my humble opinion is we more in brick and mortar, someplace to bring them to. And that's probably a lot of other states you have, is some place that specializes to bring them to, not just a county facility where they all go to, where we have limited staff, limited resources, because it's a short-term turnaround. They're designed for pretrial, and if you're sentenced, it's sentenced to less than a year. The reason why you get sentenced anything over a year, state prison has a lot more resources than a county does. So my only concern really is what are we doing with the people in mental health crisis? And I do believe that we will be arresting our way and putting them into jail, somebody that's in mental health crisis. Thank you.
What is your staffing like? I mean, do you have the ability, the staff, to be able to have, example, officers arrest somebody and they have to go back and I guess you wouldn't get involved until they were held after a bail determination was made, correct?
Right. After the arrest is made, some sort of bail put on, correct, no bail or whatever bail, whatever happens, then they become ours. And whether I have staffing or not, if they have to go back, I have to send somebody. And like we are 35 staff members short, state prison's over 100 plus short. We're all short, but it doesn't make a difference. We would have to go back, but it doesn't necessarily preclude that's going to stop from being assaulted again. Again, we're in proximity. And it's happened multiple times, even in ambulances. Unfortunately, we're in the back of the ambulance and the patient who's in severe mental health crisis, naked, doing all kinds of stuff, assaults the person in an ambulance.
Right.
But they don't turn back around and bring him back to the jail.
Right.
They take him to the hospital who has the care of things that they can do that, frankly, I cannot at a jail. So that's my concern. Those are in mental health crisis.
Thank you. Representative Manzaputi?
Thank you, Mr. Chair. Thank you for taking my question, the same question I asked you about de-escalation. How is that protocol helpful in reducing the crisis, mental health or dual diagnosis crisis? De-escalation is the first step, and how are we doing in terms of the state? And how would it impact if this law is passed or not passed?
So this law doesn't really affect my de-escalation because this will be arrested and come to me. Jails in general, that is huge. What we do is de-escalation. We train so much in de-escalation because we are there with them 24 hours a day, 7 days a week. So we do not like to get in wrestling matches or have to report. So we do a lot of de-escalation. My previous life, I was a full-time police officer. Okay, so then I moved into corrections. There's still a lot of work and good work being done out there in de-escalation in the streets. But with the acuity that is out there, it is tough to de-escalate all these situations. We're getting, I think, in law enforcement in general and people in general are getting better. But with this bill in general, for us, it is already out of basically our hands. You're arresting and bringing to us, and we have to figure out what we can or cannot help this person with.
Representative Wheeler?
Thank you, Mr. Chairman. Thank you for taking my question. So, in your opinion, the end effect of a bill like this would be the Rockingham County Jail could see an increase of mental health patients, an exponential increase of mental health patients, and one that you may not be able to sufficiently take on.
We've seen a huge increase just over the past couple of years, so our lack of capacity to take on that we have to deal with. I've been in corrections over 20 plus years, and this has been a trend going this way. I was Merrimack County for years, and I will say the state hospital here, when somebody would assault somebody, they would send them to us. And I knew the person that ran it and called them. And I got was, well, they may have had a moment of brevity. Basically, they need a break too. So they send them to us knowing that there's going to be no culpable state of mind. They're not going to get convicted. Again, I'm talking people in mental health crisis. You're going to charge, they big charge, but 9 out of 10 times it gets dropped because they have some sort of mental illness, that no culpable state of mind. And again, yes, it gets them out of the hair of somewhere else. The somewhere else is a jail, because there is no other alternative right now until some other things are built or staffed or other things.
Representative Rhodes?
Thank you, Mr. Chairman. Thank you for taking my question. So we are hearing two very different sides of the same story. So my question is, when we heard from the ER doctor that when they called and they said, well, we didn't witness this, sorry. And then the other example was, well, it wasn't, if I'm remembering correctly, a deadly threat, I think. So can you explain how is that handled? So what do you do?
Well, I can't. I mean, I could try to speak to it, but again, just because I was a former police officer. But that is on the police end. Two things: one, if it's a class A misdemeanor, that is an offense that you can go to jail for. So it's arrestable. It's an arrestable offense and go to jail. So it doesn't have to be necessarily be a felony. One, two, a warrantless arrest. For me, personally looking at it, is, you have for domestic violence and a few other ones, because within that time frame that they're going to go out and significantly hurt the person, that imminent danger, imminent flight, those kinds of things. So warrantless arrest, if you open that up, for me, what does it stop? Where does it stop there for warrantless arrest? Like you said, we have laws to protect each other. If I can now say I was assaulted and my friend saw me get assaulted, and now the police can just arrest them because of warrantless arrest, I get very nervous about that. I do think it will increase the jails. I think it will also be very difficult for police officers because you're going to see their volume go up. And again, I heard in here that, well, the police can arrest them and stay with them. They won't stay with them. It's not going to happen. This goes through. They're going to arrest them, bring them to jail, because they're not going to stay unless you're going to put some sort of bill. They have to stay because they don't have the manpower to do it. So they're going to bring it to us while they're in crisis mode. Probably could be wrestling, could get further injury, everything else. Again, to us, back to the hospital. Now I sympathize with the hospital. There's no winning with this.
Representative Janvin?
Thank you, Mr. Chairman. Thank you, Superintendent, for taking my question. I'm going back to my recollection. This bill says that it would be lawful for a healthcare provider or his agent to detain a person that has committed one of these acts until a peace officer can come and take them away. How much time do you spend initially for somebody new to the job and annually on reasonable force?
For us, reasonable force. So first we have the academy, which in there it's at least an 8-hour training, and for corrections, at least you have to do 35 hours of training a year. And use of force is one of those trainings for us that is done every single year.
Do you think that it would be extremely important for the healthcare provider or his agent to have that same training so that a person is not having unnecessary force used on them to detain them for the peace officer?
Absolutely. Anybody should have the training because, again.
Representative Selig?
Thank you, Mr. Chair. Thank you for taking my question. How many hospitals are in your district?
I did the thing in Exeter, Portsmouth. There's, off the top of my head, like 4 or 5 in Rockingham County. So there's quite, there's small hospitals, larger hospitals. So, but our designated receiving facility is Exeter.
Okay.
So they see the bulk of all of our stuff.
Okay. And the way that I read this, it would be any medical setting. So that would include all the convenient care places and urgent cares and whatnot. So if they were all saying you need to provide this, do you have anywhere close to the capacity to manage any of this?
No. And two different things. If it's somebody that's not in mental health crisis, yes, that's what we're designed for. We're designed as a jail for somebody that has broken the law that we have to deal with until they can go to court or whatever. If somebody's in mental health crisis, then the answer is no. I am over capacity now of what I have inside of there. People waiting for beds at the state hospital. They're number 21 in the queue. I have people going to spew. I'm opening up extra units specifically for mental health. I just hired another, I'm adding 26 extra more hours for mental health. The explosion of mental health is across the board, everywhere. And so the end result is we see a lot of it in the jails and a huge increase of people being arrested. And then we still dealing with them and what can we do with them? So if those places all had the ability to do this, I'm not sure what's going to happen, but the treatment would not be where I would feel comfortable for the patient or individual.
Representative Muse?
Thank you for taking my question. Can you just give us a quick overview of what kind of help or assistance you actually get to this from the state when you have prisoners who are in mental health crisis? So is any type of support available at all, or are you just expected to warehouse these folks until their trials come up or they're released?
Help from the state, little from the counties. So the counties, we support everything. It's all our budget. Like I have full-time mental health people, I have clinicians, and case managers, everything else. If somebody has to go to the New Hampshire hospital, then we have paperwork we have to do. We have petitions, all kinds of things we have to run through to get them up to there. Then if they can get there, which again, like I have somebody else, 21 in a queue, I've had people wait for months, like the hospitals do, to get to the state hospital. And they turn around and stabilize them within 2 days. I don't know how, but anyways, and they come back to us. And then for SPU, the state prison, it's far and few between we send up there. That's a really high acuity case that needs to be inside of there. But for the counties itself, no, it's your local county dollars and whatever they can afford to have inside facilities. So each facility is a little different of how much they have to offer these people that are in mental health crisis. Some have more, some have less, depending on, again, what you can afford.
Specifically, what kind of resources do you have to support these people right now?
In Rockingham County, I have a full-time mental health person on staff. I have a licensed alcohol drug counselor. I have 2 case managers. I have another through what we contract, what's called Prime Care. It's our medical. They have a mental health provider. They have doctors that come in every week, twice a week at least. We have 24-hour medical care with our nurses. So we have a pretty robust, we're the second in the entire country for county facilities that have our own opioid treatment program. But then you take it to another facility. A lot of the facilities are not 24-hour care. So there's no nurses on it in the middle of the night. They don't have, the mental health might be a person that's part-time, okay, because that's all they have. So you're running the gamut. Rockingham County, where I'm at now, is the 3rd jail I've been at. Okay, I was at Carroll County before, very small, a very limited budget, limited what I had up there, to where I have very, very robust of what I have now. So it's really all over the map depending on which jail you're at.
Representative Newman.
I just have a quick question. You've drawn a pretty bright line between people that are in mental health crisis and those that are not, that either one of those could cause a disturbance. And just in my reading in the bill, and it appears to me, and we'll probably talk more about this in executive session, is that the bill itself it says detain any person. Do you think that bright line distinction between those 2 types of people is important in this case?
I do, because someone who's in a mental health crisis needs a higher level of care than what a jail can support. Again, let's go back to the medications that it cannot do. There's a lot of things in it. It's concrete and steel. It was not built for, none of the jails built for mental health patients. And that's what they are. They're patients. If they're in crisis and they're patients, in my mind, that's what they need to be taken care of. So I do think there should be a line that is distinct, and how you want to define that and however you want to clear them. Because in 2021, if everyone goes back to that, there was a part of the bill that said that they had to be cleared from their mental health crisis, but it was never defined who cleared it. I asked, was it chiefs of police? They said no. I asked if it was the jail. No. Is it the hospital that wants some, no offense to hospital, they want them out of there? It's their best interest to get them out. And then I bring them back. And then I have mental health people on to say, well, wait, why are they here? And I can tell you, just this week, I have one from a hospital who's been released twice, came back to us and is a mess. I'll take it one level further, mental health crisis. I just went in at 1:30 this morning for somebody who passed away because their mental health crisis and drugs didn't belong to me, but they're no longer here on earth. Okay, so this is what we're dealing with.
Thank you for your testimony. Chair calls Paula Minahan.
Thank you. If you would indulge, could I have John Patty join me? Thank you. He has a card. Yep. Good morning, Mr. Chairman, members of the committee. For the record, Paula Minahan, Senior Vice President, State Government Relations for the New Hampshire Hospital Association, representing all our hospitals. With me today is John Patty, Executive Director of Support Services at Catholic Medical Center in Manchester. I will not read my testimony. It is being passed out. We are in strong support of 58. Excuse me, Senate Bill 58, and we do appreciate Senator Gray's support and sponsorship of this bill. As you have heard, there was a big change in this bill, which got changed on the Senate floor. We support the concept of Senate Bill 58, and I have communicated with a number of you in the past week or so regarding why this isn't so important in the history of this. And I am not going to take a lot of your time because it is more important that you hear from those that actually have experienced this and witness it every day, including Mr. Patty, who will speak in a moment. All I need to say is I think some testimony, unfortunately, is conflating issues. This is not intended to criminalize behavioral health. This is really a tool, as the representative indicated. This is a tool for law enforcement. They need this. They are not here to testify, but they do not have. And again, Mr. Patty will talk about this in a minute. They don't have they believe, the authority at this time, law enforcement, to come in and arrest someone without a warrant. We do not support enhanced penalties, and there are reasons for that. I know other states have done that. Unfortunately, my colleagues have indicated throughout the country it doesn't work. And so this is the approach that we are taking, and other states actually have adopted our approach. I know there are at least 2 other states that are trying to get a similar bill as introduced passed, because enhanced penalties for some of these offenses just will not work. And as indicated by others, these are healthcare professionals that want to care for patients. That's why they went into the profession. They do not want a felony on someone's record, and because that is a pretty significant offense, as you're aware. So let me just see here. We are happy to work with the committee, and I have stated that to many of you, that we want to we believe that it is important that we pass something that ensures that healthcare workers are protected when they are assaulted while they are performing their work. We owe it to them to ensure that we provide law enforcement with another tool that they can have when they are called to the hospital to respond to an incident. Without the ability to arrest without a warrant for misdemeanor offenses, when appropriate, the healthcare professional is not protected and remains vulnerable when they are treating patients. And at this point, I'd like John to talk with the committee about his experience and what other security officers have witnessed in the past few years. Thank you.
Thank you, Paula. Good morning. Thank you, everybody, for taking the time to consider this legislation. So, yes, I'm John Patty. I'm Executive Director at Catholic Medical Center. I'm also a retired sergeant from the Manchester Police Department. I have over 22 years of experience there. So, as Executive Director overseeing security, I'm aware of the reports of assaults on our employees. On many occasions, we would call the police to report the assault on a healthcare employee, only to be told by the police that they would not make a warrantless arrest, but rather apply for a warrant. I'm going to ask you, imagine how frightening it is for a healthcare worker who has just been assaulted by somebody to have to remain in that intimate setting and still provide care. I heard domestic violence referenced earlier. Part of the reason for the change in that statute was to be able to separate the assailant from the victim. The police are basing their decision not to arrest based on language in the current statute under 594.10, which reads in part, if not immediately arrested, such person will cause further personal injury or damage to property. This language essentially requires the officer to predict future behavior of the suspect in order to make a warrantless arrest. In my opinion, not making an arrest at that juncture places the victim at risk of another assault, which essentially equates to a pattern of abuse. With the unique perspective of having been on both sides of this issue, I wanted to amend the language to provide police with more clarity in the statute, which would give them greater confidence in making a warrantless arrest. while at the same time providing our healthcare workers a measure of safety and assurance and allowing victims of a crime a sense of control and protection. There are current statutes that provide the police the authority to make a warrantless arrest for certain misdemeanor level offenses, and I'm asking the same authority be specifically granted to police in the case of assault against a healthcare worker by a patient. If you're not aware, assaults and workplace violence at healthcare facilities has been increasing concern for healthcare workers. Depending on the publication you read, stats indicate that healthcare workers are 4 to 5 times more likely than other private industry employees to be victims of workplace violence. There are many studies, including some from OSHA, that show the prevalence of assaults in these settings to support that data. Part of the work that went into this bill last year focused on the need for collecting relevant data to support the need for a workplace violence prevention program for healthcare facilities throughout the state. This data will be used to support a commission to review and analyze healthcare workplace violence and safety issues that are affecting our healthcare workers and organizations. When I began this process of trying to have legislation passed to address this concern, which I consider to be a victims' rights issue, I began collecting data from other New Hampshire hospitals. Between January of 2020 and June of 2021, so 18-month period, 13 of the 26 hospitals reported data to me that indicated they had 671 assaults during that 18-month period. And as Senator Gray spoke to earlier, 7 hospitals, that's it, just 7 so far this year. Through February is when I collected the data, provided stats that show there were 50 assaults so far in our hospitals. Just to address some of the prior testimony, if I could, there'd be no CMS risk for hospitals for detaining a patient. Probably 6 years ago now, I had come before the Senate earlier to request legislation for security healthcare workers. After I retired from the police department and went to work as the director of security at CMC and saw what the security officers dealt with, I was amazed that there was no protection for them in the statutes. So I had requested that some legislation be passed, and it was RSA 627:6, Roman numeral 8, that gives them the right to maintain decorum in the hospital, is the way the language is written.
Could you repeat that statute again, please?
Yes, 627:6, Roman numeral 8. And the issue of the mental health crisis is real, not minimizing that at all. However, I strongly feel that, victims of these crimes have rights too, and this is where this is coming from. I know as a police officer, if I was called to an event involving somebody who was having a mental health crisis and they assaulted the police officer, they would be charged. That's a fact. So it's real. It's okay that they be charged. We're not minimizing their crisis that they may be in, but it still doesn't give them the right to assault others. Thank you very much for hearing my testimony.
Thank you. Could you explain to the committee who's going to make the determination in this situation? Who is suffering from a mental health issue and who is just being a criminal? When you have a patient assaulting a healthcare worker or a security officer, the police are called. They now have the power to arrest. Who's going to make the call? And once they make the call, where do they go with the patient?
So different considerations, right? Not every assault is committed by someone in a mental health crisis. However, the statute reads that, when a person is IEA'd, involuntarily, they're brought to a hospital for a treatment, right? So then within 72 hours, they have to have a hearing on that. So if they've been committed, if they are in our care as a IEA patient, they've been committed to the state, so they are not free to leave anyway, right? So they would still be eligible for a bail hearing, but they're not going to be free to leave. That's, you know, one thing that if they're committed, right? They're committed to the state for a reason, and they have to be, you know, they have due process and they have to go through their hearing. However, there are many instances where our healthcare workers are being assaulted by, you know, patients who may be under the influence of drugs, right? And, you know, that's a consideration as well for, you know, the community, right? But, you know, they're not getting the same consideration as mental health patients, right? So we're not minimizing their actions just because they're under the influence of drugs. So when we train new staff coming into the hospital, I often pose this question to them. I said it because I was amazed, quite frankly, not to be dramatic, but to see the behavior of some patients in the hospital, it was stunning to me. I was shocked. So I tell them, I said, you know, in order to make a determination how you should handle this, I said, take that person's behavior and move it to a restaurant on Elm Street in Manchester, right? Would anybody put up with that? No, and they shouldn't, right? The police would be called. And so the behavior that goes on in the hospital is shocking.
Agreed, but to my question, who makes the determination at that moment this person should go with the police to be held, or is a mental health patient, setting aside someone who's been involuntarily committed?
Sure. So I think any hospital, any medical provider would tell you that the patient would have to be cleared medically first, right? So if the person is not able to be medically cleared, then that would be a consideration for all parties, right? The doctor, the police. You know, the police still have to do their investigation, make sure that there is probable cause to make the arrest. And then, you know, this is not a mandatory arrest, right? So they still have the right to make that decision and not arrest at that time. However, to your point, it would be the police and the healthcare worker making that decision.
Representative Jammer.
Thank you, Mr. Chairman. And this question is for the person's security here. You've obviously been through the police academy, and you know that there's a lot of time spent on use of force training, constitutional law, criminal code, the different thresholds of evidence to support a detainment or arrest, and how much time is spent on handcuffing, defensive tactics, and restraint. How much time do you spend with your security officers in your hospital of that same training?
So we have 120 hours of, you know, it's field training essentially, and then we have 3-hour use of force class to begin with. That's part of their initial training, and then we have annual use of force training similar to police departments.
Follow up. And I know you can't speak to this, maybe the hospital association can. Is that the standard for all hospitals in the state of New Hampshire?
It is not the standard. However, part of Senate Bill 459 last year will require hospitals to provide training to staff.
Representative Mangiapudi.
Thank you, Mr. Chair. Thank you for taking my question. The training aspect of the staff, whether not just the security staff at the hospital, but also all staff involved in the hospital, do they get training of self-defense as well as de-escalation training?
So some hospitals provide it. We do. I can't speak for all. But again, part of Senate Bill 459 last year is that that will be a requirement.
Representative Murphy.
Thank you, Mr. Chair. Thank you for taking my question. I just wonder, looking at SB 58 as amended by the Senate, and then the floor amendment to it's Senator Rosenwald's floor amendment, are there one of those that you think is preferential and would meet the needs of hospital staff as opposed to the other, or I'm just looking because I see there are some differences, and they certainly amend different statutes. So
Right,
I just wonder.
right. Thank you for the question, Representative Murphy. So as Senator Rosenwald indicated, the amendment that did not pass the floor, that was the language that was worked on during the study committee back in 2021 and what was part of 459 last year. That did not go all the way through. It was pulled out on the floor of the House, and that's what resulted in Senate Bill 58. Her amendment moves the reference of medically necessary to the end of the sentence, but essentially her amendment, which is 1251, is what we worked on as she referenced in her testimony with the stakeholders. What passed was the floor amendment that Senator actually Senator Gray introduced, and that was what was agreed to by some of the senators, and what did pass 14-9 on the Senate floor. So I would say, as my testimony stated, this is a very, very important issue for us. We are happy to work with any and all of you to get to yes. But we could live with the amended bill, but I know not everyone here that is going to testify is supportive of this language for various reasons. We believe it is a creative approach to getting to the solution that we're looking for, or the goal. But to be clear, we worked on the original language of Senate Bill 58. That's where we kind of landed as the healthcare community, or the hospitals, certainly.
Thank you. So the floor amendment, Senator Rosenwald's floor amendment, was the one that was generally agreed to by the stakeholders.
Yes.
Okay. Thank you.
You're welcome.
See no further questions. Thank you both.
Thank
for your
you very
testimony.
much.
Thank you.
You don't have to.
Holly Stevens.
Thank you. Good morning, Chair, members of the committee. What I'm passing around is my written testimony, as well as the written testimony of one of our NAMI New Hampshire members. She was going to be here today, but the court is holding a session where they're mapping the intersection of mental health and criminal justice, and she was invited to that. So unfortunately, she wasn't able to be here today, but I do have her written testimony, and may read part of that if the committee would allow me to. Thank you for the opportunity to testify today. My name is Holly Stevens. I'm the Director of Public Policy at NAMI New Hampshire, the National Alliance on Mental Illness. NAMI New Hampshire is a nonprofit grassroots organization whose mission is to improve the lives of people impacted by mental illness and suicide through support, education, and advocacy. On behalf of NAMI New Hampshire, I'm here today to speak in opposition to Senate Bill 58 relative to arrests without a warrant while in the care of a medical professional on the premises of a residential care or healthcare facility. And I just wanted to let the committee know that we did not testify on this bill when it was in the Senate, because at that time, we were one of the stakeholders that worked on the language and had agreed not to oppose it. As I mentioned, by way of background, for the past 2 years, NAMI New Hampshire has been involved with a stakeholder group discussing the issue that is the subject of Senate Bill 58 and was the subject of a study committee, the Committee to Study Workplace Safety in Healthcare Settings. At that time, the stakeholders agreed to statutory language regarding the use of warrantless arrests in healthcare settings that could be added to the current warrantless arrest statute. The committee's final report contains the language all stakeholders agreed to, which was also the language as Senate Bill 58 as introduced and as you've seen in the Senator Rosenwald's floor amendment. Despite all stakeholders being in agreement on this language, Senate Judiciary introduced an amendment that no stakeholders were able to provide input on as it was brought on the floor of the Senate, as you have heard earlier today. This amendment makes changes to the detainment statute, allowing for hospital personnel to detain a person who is suspected of committing a misdemeanor assault. Due to emergency room boarding, the emergency room boarding crisis, where people in psychiatric crisis are waiting for an inpatient bed for days to weeks, many times being held against their will, Senate Bill 58 will disproportionately affect individuals experience a mental health crisis. And I know you've heard from the medical professionals that they do not believe this would disproportionately affect people in mental health crisis. But I think we also heard Senator Gray specifically say that most of these assaults are being committed by people who are either in psychiatric crisis or there for substance use disorder. Recently, NAMI New Hampshire has heard from 6 families whose loved ones have been arrested while on an IEA, an involuntary emergency admission, in an emergency room. Their stories are heartbreaking and speak to long waits in the ER, ranging from a few days to 2 weeks, while receiving little to no treatment. Due to this, several of the families describe situations where their loved ones, many of whom are experiencing symptoms of psychosis and don't know what's going on, have become agitated, resulting in the hospital engaging in a physical restraint, which ends with the patient assaulting a hospital staff or destroying hospital property. These loved ones were then brought to the local county jail, where they remained while waiting for a hospital bed. As you heard Superintendent Henry mention, that this is often what happens. If Senate Bill 58, as amended by the Senate, passes, more and more individuals and families will have to endure this same result. People experiencing a psychiatric crisis need treatment, not jail cell confinement. It is important to note that an officer can arrest for a felony level offense, as you've heard earlier, whether it was observed by the officer or not. Therefore, we are not talking about those offenses rising to that level, but only misdemeanors. It is paramount that people psychiatrically boarding in an emergency room continue to have due process protections afforded to them under the law currently. If Senate Bill 58 passes, people in a mental health crisis would be brought to county jails for misdemeanor offenses, even if they are completely calm when the police arrive, exacerbating the crisis that they are experiencing. And for these reasons, NAMI New Hampshire opposes Senate Bill 58. I'm happy to take any questions, but I did want, if I have time, I'd like to read a little portion of her testimony, or if the committee prefers, and I'll let the chair let me know, would you prefer that you read that, or would you prefer?
What you're speaking of, you did give to us?
Did give to you, yes.
So we would prefer, instead of you actually reading it, if there's a certain, if there's like a bullet or two you would like to highlight, you're certainly welcome to share that with us, but we would ask that you don't read what you already handed us.
Yeah, I wasn't going to read the whole thing. I was just, I'd like to read her description of what it's like to be in an emergency room for these folks. If you've not been inside it, I can share about the Yellow Pod. The Yellow Pod is the place in Concord Hospital where they hold psychiatric patients. There are a few, about 8 to 9 or so size windowless rooms with a door to each and a bed. Nothing is allowed that can be used to harm self or others. No personal clothing, pens, or anything like that. It is cold in there, but everyone has to deal with that. You can sit, lie down, or move about in a room assigned to you. You're supposed to keep quiet in there, but it is often stressful sounds, people yelling or crying and screaming, and sometimes it is somewhat more quiet. Only certain staff are allowed in or out with a badge who have the right to access it, and at times limited visitors. It is only for people deemed at imminent risk to themselves or others due to psychiatric illness. In the Yellow Pod, you wear paper scrubs and gripper socks, and you are monitored 24/7 by staff in the area who do status evaluations and provide transitional psychiatric nursing care to the patients. There's also a common shower toilet, which patients can use, which they are escorted to and monitored during use. She goes on to talk about her son on day 13 becoming very agitated. He was then walking around his cell, pacing it, his room, and pacing it and doing kicks. Not hurting anybody, not hurting himself. But the staff asked him to calm down. He couldn't calm down, so they attempted to put him in a 4-point restraint, at which time he stepped very hard on one of the security guards' feet. He was then arrested and taken to jail. Now I will answer any questions that you may have.
Representative Prue, did you have a question?
So, you know what? I'm not gonna.
No? Representative Newman? That's
Thank you, Madam
appreciated.
Chair. My question is, your preference, you're opposed to the bill as it is right now amended by the Senate, and your preference would be to have the original language of the bill as amended by the Rosenwald Amendment, is that correct?
Well, let me be clear. We were never in support of this bill to begin with. When we worked with the stakeholders, we agreed not to oppose it with the language that they brought forward in Senate Bill 58 and the language that was a part of Senate Bill, I believe it was 459 last year. So we're not in support of any language, and I'm requesting right now for this bill to be ITL'd.
Thank you.
Representative Prue, question.
I reframed it in my head. So, I hear your concern for the patients. How do you suggest we address the concerns of the healthcare workers?
They are still able to press charges. And if somebody is completely calm, being restrained by chemical restraints or by physical restraints, there's no reason that a law enforcement officer cannot leave the premises, go get a warrant, come back with it, and then arrest the individual. They don't need to be arrested under a warrantless arrest. It's about the due process that's being afforded the patients. And so I would argue that if somebody is being chemically or physically restrained and are no longer a threat to anybody in the hospital, that the officer can leave, go get the warrant, and come back and then arrest it if they're able to obtain a warrant based on what they hear from the hospital.
Follow up? Do you know how long they can chemically restrain them?
I don't. That would be a question for the hospital.
So they could come out of that chemical restraint and then act again while the officer's off getting a warrant. Is that true?
Potentially, yes.
Yeah, that's what I
They
thought.
could also act up again if they're brought to the county jail and are then processed, brought back to the hospital because they still need treatment and left there.
Representative Muse?
Thank you. To kind of sum up where we are, it sounds like both versions of the bill are objectionable to you, but it sounds like the original version of the bill is less objectionable. Can you tell us why that might be?
Yeah, we know we do not oppose Senator Rosenwald's amendment, and that is because that amendment still affords the protections under the due process where, you know, I read the exact language. The language that's contained here, there's also more language that basically says that if there is a continued threat, that's when a warrantless arrest can be done. But if there's not a continued threat, if the person is no longer a threat, then that's when the officer would have to actually go get the warrant and come back. So that's the protection that's in the Rosenwald amendment that is not in the current bill.
Thank you for clarifying that.
Representative Mangiapudi?
Thank you, Madam Chair. Thank you for taking my question. So basically, what NAMI is saying is protect the due process for people with mental illness. And this bill doesn't go so far to make sure that protection is available to the mental health crisis, people with mental health crisis, versus what is the threshold to be established for the providers it's a delicate balance. So what is the level that we can reach to protect the people with mental illness, and where does that fall with Senator Rosenwald's?
Yeah, we did reach that agreement, a couple of years ago, and that's why Senate Bill 459 was brought forward, and that's why Senate Bill 58 was brought forward again this year. But yeah, the Senate Bill 58, as introduced, does afford the protections that NAMI New Hampshire thinks are important for people who are boarding psychiatrically in an emergency room.
Seeing no further questions, thank you for your
Thank you.
testimony. Ms. Nabel, I think I'm pronouncing that properly. Pam?
Thank you. It's actually Pam DiNapoli. Poor handwriting. My name is Pam DiNapoli. I'm a nurse, and I represent the New Hampshire Nurses Association, which is a membership organization of over 2,000 nurses, and we represent the 20,000 nurses in the state. I did submit my written testimony, and I'm not going to speak to that testimony, but essentially what I submitted was results of a survey that we recently conducted of emergency room personnel in the state to ask them about this bill, and overwhelmingly they were supportive. And so what I want to do now is just kind of talk about some key points that I'd really like to focus on. Number one, there is no federal legislation currently that affords the same protection against workplace violence as other industries such as the airline workers. So we know that violence in healthcare settings is only intensifying, and contributing factors that I want to highlight include workforce shortages, which aggravates a population that's already aggravated. So increased wait times, substance use, and overall societal tolerance of this behavior. This bill is focusing on misdemeanors. So while healthcare professionals do have protections against felonies, not misdemeanors. One example of this is a patient refuses a medication and the nurse brings in the medication, the patient punches the nurse goes to employee health, the nurse is cleared to go back to work. She goes back to the emergency department, the same patient is there, and she's required to care for that patient. She's asked by security, does she want to press charges? She says yes. The police come, they do an investigation, and they say, we have no grounds to arrest this patient. There are no legislation that prevents assault against healthcare workers in this situation. We could issue a summons on discharge. So at that time, the nurse now is required to care for a patient who has already punched her in the face. We hear a lot of opposition that this says criminalizes behavior, and I think you heard testimony that arrest is not required. So the due process is still guaranteed, and then the decision to make the arrest. One thing that hasn't been mentioned and may seem irrelevant, but is very relevant to us, is that currently in Vermont, there's State Bill 36, which is an act relating to permitting an arrest without a warrant for assault and threatens against healthcare workers and disorderly conduct in the healthcare facilities. While this is relevant, is that many of our nurses from New Hampshire work at Dartmouth, and many Vermont nurses work at Dartmouth, which is in New Hampshire. So can you imagine being a nurse who's working in New Hampshire, lives in Vermont, who's covered by this law, but the patient can't be arrested in New Hampshire, and nurses knowing that we have been trying to advocate for this law for over 8 years. So I think one of the words that I've heard over and over is toolbox, and while this is it's not going to prevent the problem, it's really going to enhance the ability for us to protect our healthcare workers, which in time of workplace shortage is really relevant. I think the other thing that I want to say is that all of our nurses are trained in de-escalation techniques. So de-escalation is not prevention, it's an intervention. And what we want to do is we want to think about prevention, and this act may be a deterrent. So a patient who is investigated by the police for assault may think again about this. And I do understand NAMI's position and the position of the testimony around the mentally ill, But that's the population that nurses are really trained to de-escalate and deal with. It's the patient who just pops off because they're mad that they had to wait 20 minutes to be seen in the emergency department. We can't predict that. So in the behaviors that we can predict, we have interventions. What we want to do is to try to think about deterrence. So those are the important points that I think are important to us as nurses in the state. So thank you for letting me speak to the bill.
Thank you for your testimony. Chair calls Giles Bissonette from the ACLU. Giles.
Thank you, Mr. Chairman, members of the committee. It's nice to be here. Gilles Bissonette, I'm the legal director at the ACLU of New Hampshire. We're here to testify against the version of SB 58 that was amended on the Senate floor. And I can explain why, but I do want to flag as well that, like NAMI New Hampshire, we do not object to the original version of SB 58 as introduced, including the clarifying language that Senator Rosenwald added. So no objections to that language. We were involved in negotiating that language, so I just wanted to be very clear. But the new version that is before this committee is something that we have profound concerns about, and I would like to outline those. But I do want to just say a few words about the history of this. This has been the product of negotiation and discussion now for almost 2 years, I think to get to that language that we ultimately agreed to took a lot of thinking and a lot of reflection, particularly reflection with respect to the real concerns that have been raised by hospital staff. They're real. These incidents are certainly to anyone who visits a doctor, which is most folks, or physician, or any type of hospital staff. You know, it is concerning when hospital staff are assaulted. But there are also some serious interests on the other side, right? Including the ability to make sure that due process exists, due process insofar as people aren't arrested without, that are not needlessly arrested and having their liberty needlessly restrained. And of course, the other countervailing interest being, I think, our general desire and the general consensus that we shouldn't be criminalizing mental illness, that folks need treatment. They don't need jail if they're going through particular crisis. And I do think the original version of SB 58 really reflects that balance. And I'll explain why in a few minutes. But I also want to flag that the Committee to Study Workplace Safety that is a product of that negotiation, I have attached to my testimony as Exhibit A, so you can see exactly, where the committee landed 2 years ago. And the language in SB 58, the original version, is reflected in that report. And of course, that report, among other things, also talks about the need for de-escalation techniques and the need for more data, frankly, on the degree to which assaults are occurring in New Hampshire. There is a lack of data. Anecdotes, sure. Real incidents have occurred, sure. But the degree and scale, how many of these are felony assaults, right? How many of these involve individuals who are going through crisis? I don't think yet we have a good handle on that information. And that was in part designed to be addressed in SB 459 passed last year, which hasn't yet gone into effect, which will go into effect in mid-2023, which is designed to address some of that data, those data issues. So my own view is, before you strip away some of the due process protections in the warrantless arrest statute, which the as amended version of SB 58 would do, I think we should let's see how that bill unfolds with respect to the data that we ultimately evaluate. But as I said, on the Senate floor, this compromise language was ultimately upended. And the vital protection that was removed in the original version of SB 58 was the ability to conduct a warrantless arrest. Really, we're just talking about misdemeanor arrests here, and I'll explain why. But the ability to conduct those arrests where there is actual or threatened violence, which I think is a very important limitation. The new version that's before you strips away that protection, and that is the core of my concerns and why I'm here today. Because SB 58, as amended, would allow for a warrantless arrest for a violation or misdemeanor offense in the absence of any serious bodily injury, which is defined in law. It's footnoted in our testimony. And also would allow for a misdemeanor arrest with the absence of any imminent threat to life or property. So I do want to say at the outset, when you look at our warrantless arrest statute, I've attached it to my testimony as well, RSA 594:10. It allows for warrantless arrests for offenses occurring outside the officer's presence in two situations that I want to flag. The first is if there's serious bodily injury, because that would be a felony. So that's already covered under existing law. Now, in the absence of serious bodily injury, what we're really talking about here is misdemeanor simple assault. A warrantless arrest can occur if, without an arrest, there's an indication that that person will cause further personal injury or damage to property. So I just want to submit that I do not think it is completely accurate that nothing can be done in these situations. That is the regime that we currently have in law. Perhaps one of the many solutions to this is just better education with law enforcement of what the parameters are for arrest, and how even with a misdemeanor simple assault, there still is the ability to conduct a warrantless arrest. Again, if you can show or demonstrate by virtue of what was said or the assault itself that there is a likelihood that there could be future personal injury or damage to property. And I know the concern, well, that's predictive. How do police officers do that? Police officers, respectfully, they do that all the time. One example, right, is in the involuntary emergency admissions context, where law enforcement and healthcare staff even will make the prediction that that person, by virtue of what they have done, is likely in the future to be a danger to themselves or others, right? So I think this is part of the general law enforcement function already. And of course, even without an arrest, right, law enforcement can be present. They can be called and they can be there, even in the absence of a custodial arrest. I know obviously there are time limitations for law enforcement, but I just want to flag that is still an option at the end of the day. But for misdemeanors, the language in current law that there can only be a warrantless arrest if there's likelihood of further personal injury or damage to property, I just want to flag that as a key civil liberties protection at the end of the day, to make sure that people are not needlessly detained. Because our view is, if law enforcement want to arrest someone, the crime either needs to be without a warrant, it needs to be really serious, a la serious bodily injury, or there needs to be a likelihood of future injury or damage. The compromise in the original version of SB 58 struck that balance. And it did so by having the language that for an arrest to occur, warrantless arrest, there must be actual or threatened violence while a person is interfering in the provision of medically necessary healthcare services. So, maybe not perfect to some, but I felt like, as an ACLU lawyer, as a civil libertarian, like, that's close to providing some of those due process protections, but while recognizing the very real concerns that have been raised here. And the second point I'd just like to make is I know obviously there's a lot has been said about we're not trying to criminalize mental illness. That's not the point of this. I'm a lawyer, so I look at the text. That may not be the intent. I think that is what will happen here. There's nothing in the language of the text of this bill that says, a person can only be arrested if they're medically cleared. There's nothing in the text that says, this isn't going to apply to people going through mental health crisis. I mean, at its core, this would allow for warrantless arrests for simple assaults, absent any indication of future harm. And I just want to flag what a simple assault is unprivileged contact. That's what simple assault is. In many instances, it can be severe, to be sure, but in many instances, it will not be severe. And what this bill allows is, in all situations, it provides as a tool the ability of that person, without any indication of future harm, to be pulled out of the healthcare setting and now funneled into the criminal justice system. And I know that with emergency room boarding being as prevalent as it is, I do think that it is very likely that it is that subsection of individuals who are going to be caught within the web of this new particular regime. The last point I just want to make is that unlike prior iterations of this bill, this is kind of a unique regime in that it is modifying a bill that deals with motion picture theater owners and merchants, which is, I think, very creative. But this is very different. The hospital setting is very different from motion picture theaters or from merchants. Well, those statutes are dealing with, people kind of sneaking their way into a movie theater, right? Or individual shoplifting. We're talking about healthcare settings. We're talking about people who don't want to flee or necessarily even evade. They're there to get healthcare. So I just think the context is fundamentally different. And I think assault is different than shoplifting. I think it's harder to kind of, the legal permutations are just kind of different. But I also think what this statute does too is give hospital workers themselves the ability to detain, which is, a pretty significant increase in authority. I'm not sure that was contemplated or that hospitals even want that, but I do want to flag that particular issue in this bill as well. So with that, I know I spoke a lot, but I just wanted to flag these concerns. Again, my recommendation would be the original version of SB 58 with the caveats or the small modification that Senator Rosenwald submitted. We would have no objection to that, again, because we were involved in negotiating it. Thank you.
Representative Prue.
I kind of have two things. So I hear you wanting to protect the civil liberties of the patients. What about the civil liberties of the healthcare workers? It's okay for them to get groped and just beat up a little bit?
No.
I'm asking a question.
Oh, sorry. Sorry, I didn't mean to interrupt you.
No, you're okay.
No, it's absolutely inappropriate. So, and they can be arrested and they should be arrested. What we're talking about here is a warrantless arrest, right? So the point that I'm trying to make here is whether someone is arrested on the spot or not, that person can and maybe even should be charged. What this bill is trying to get at is that kind of exigency of, we need to immediately get in and extract that person because there's an urgent harm, right? If that's what we're trying to get at, the language of the bill needs to be clear to specify that if we're going to allow for a warrantless arrest, there needs to be exigency. In SB 58, the original version, it was through actual threatened or physical violence. What this bill does is it strips that away, right? It allows for a warrantless arrest even when there is no indicia, reasonable indicia, that there is likely to be a danger to property or a person in the future. And I think that to me is the core, and the balance that I'm trying to strike here is, allowing for those arrests without a warrant when there's exigency, because that's critical, I think, to protect hospital safety, but at the same time, trying to make sure people aren't needlessly detained when there isn't an exigency, particularly when we're dealing with a concern that those people that may get swept up within this regime are undergoing a mental health crisis.
Representative Haken Phillips.
Thank you. Thank you for taking my question, Mr. Bissonnette. So I'm looking at the original language of SB 58 before the Senate amendment took place. I'm just going to ask you a simple question about the threshold that is now reasonable grounds, but before was probable cause. And what does that lowered threshold, in your opinion, pose for, the determination of whether or not someone's actually violated, any sort of clause in the new law that might cause them to be warrantlessly arrested?
I'm just looking at the language. Bear with me real quick, Representative. So the question has to do with the probable cause language, that the police officer has probable cause, and then going down on SB 58 as introduced, that while in the care of a medical professional, that through actual or threatened violence, the person will interfere. That's the probable cause. So I haven't viewed the probable cause piece, frankly, as really a material change. That it is another way of, to some extent, reframing existing law, but doing so in the context of hospital settings in particular, in recognition of the concerns that they've raised that are real and that have some data to back them up. So I don't think that standard, it's not something that has concerned me because I haven't viewed it as being that much of a material change relative to existing law. I think the bottom language in bold, that is kind of the material change that's designed to reflect the concerns of healthcare workers.
Thank you for your testimony.
Thank you, Mr. Chairman.
Chair recognizes Michelle Dodd.
Okay. Good morning, Chairman Roy, members of the committee. My name is Michelle Dodd. I'm the Chief Nursing Officer for Portsmouth Regional Hospital. I come before you today in support of Senate Bill 58. I'm just going to read, I've also passed out a short copy of my testimony. Our team is composed of dedicated healthcare professionals who chose a career of service to our community. They proudly show up every day to save lives and care for the patients we serve. The pandemic accelerated what was a workforce shortage into a workforce crisis. In addition to that, as you've heard this morning over and over again, we now have a significant increase in workplace violence that our teams have to face. In 2022, our facility alone saw 58 employees physically injured from trying to care for their patients. This year, we've already had 13. And to be clear, these are not minor injuries. They are punched, bitten, scratched, choked, have equipment thrown at them. We had one employee who suffered fractured orbital bones. We have another employee who has permanent hearing loss from being hit in the head. We had one patient who injured 6 employees in 2 days. And we had a medical patient who injured 2 employees in 1 day. And of course, many of you have heard from the assault at our Frisbee sister hospital of Richard Simo, who unfortunately died. And that incident had a very deep impact on all of us in our community. As you've also heard this morning, in order to recruit and retain staff, our employees have to feel safe. They have to feel safe while they're delivering the calm and empathetic care that they show up to provide. And remember that as we rebuild this workforce, our nurses are new graduates. They are young. They're at the beginning of their career. And for them to come in every day and have fear and watch these events happen and wonder, is that going to happen to me? Am I going to have a permanent injury this young in my career? That's not okay. This bill provides a critical tool, in our opinion, to our law enforcement partners to support us. With their partnership, we believe that we can reduce the number and severity of injuries to our staff and ultimately create a safer environment for our healthcare workers and our patients. So as such, I ask you to support SB 58. And I'm happy to answer any questions.
If I could, the incident you said where the patient assaulted a number of employees, the same patient did. How would this statute have stopped that? Was that person admitted? How did that come to be?
Sure. In that situation, if this statute was in place, our partners in police would have been able to, as you've heard this morning, show up and help us assess that situation. I do want to also add that I believe that, as you also heard from Dr. Grossman, that our providers and our nurses advocate very strongly, despite this, for our patients. So I believe that they would partner with that patient and help decide what's best. In this case, they couldn't. It's what you've heard this morning. There was nothing they could do because they didn't witness it. And so that continued and continued. And we were limited, our team was limited on what they could do despite all the training that we provide. We were certainly compliant with the laws that have come out, and we had that in place before that happened, because that empowers our team to be safe as we can make them. But there's a lot that they can't do that our police partners can do to help partner with us in that case. In this case, this patient ultimately was taken to jail, but after many, many, many injuries and many, many requests from all of us on the admin team, standing side by side with our frontline staff, to include Dr. Grossman, as you heard, watching this happen, going, please, you've got to help protect our staff.
Was that patient admitted? Why was he there so long, I guess is what I mean.
Sure. He actually was waiting for psych placement in this particular case. He actually did very, very well for quite a long time. And then he had an incident with one of his family members that he just snapped and became quite violent towards everybody and ultimately was taken.
So was the involuntary commitment procedure initiated against that patient?
Yeah.
And does your hospital have a secure facility to hold patients that are?
We do have a pod in our ER if we need to. Yeah, in this case, he could not have been with any other patient. That's how violent the one patient was.
Okay, thank you. Representative Salik.
Thank you, Mr. Chair. My question is very brief. I'm curious whether you're speaking in support of the bill as it was originally written or as it was amended.
We would support both.
For your testimony.
Thank you.
Chair calls Karen Rosenberg.
Good morning. I'm Karen Rosenberg from the Disability Rights Center. I'm the policy director, but I've been at the organization previously as a staff attorney for about almost 18 years. And I'm here to testify against SB 58 as amended by the Senate. Although I understand workforce safety in our healthcare is of paramount importance, really. I mean, we want our clients to be able to be safe when they get treatment. That means we need workforce to be safe. But this bill does not solve that problem. And in fact, it could make things worse at our hospitals. And I want to talk to you about some of the situations that we hear about, because I think this is about criminalizing mental health. And I also want to talk about some of what I'm handing out to you are 2 laws of federal regulation, which could be implicated if this should pass, as well as our state Patients' Bill of Rights, which could also be implicated if this bill should pass as amended. Our office regularly hears from people with mental illness who are facing lengthy stays, mostly at EDs, who are either IEA'd in the process of being IEA'd, involuntarily admitted due to being in a mental health crisis. I've consulted with some of the staff attorneys with my office to give you some recent examples of who these people are and how their behaviors could result in them being deferred to the criminal justice system instead of getting medically necessary services. Because remember, what we're talking about here are misdemeanor offenses that would justify a warrantless arrest. We're not talking about a felony. We're not talking about them not getting arrested at all, but how it is that someone with mental illness could end up in a situation where they're diverted unnecessarily to a county jail or to court. So one example I have is a woman who had previously experienced numerous sexual assaults. And when she was brought into the hospital, generally what happens is there's a safety call from a neighbor or a family member. She was in a mental health crisis. The police come. They cuff her like they do with most people, throw her into not throw her, but put her into the back of a police cruiser, take her to a hospital that is really not staffed to meet her needs. Her clothing is removed. Her phone is removed. She isn't allowed to have no personal objects at all. She's put in a room with nothing, not a television, not a book, nothing to do to distract her. Anyway, so this particular person was really, really agitated. Like I said, history of sexual abuse by men. So, she's thrashing and screaming and hitting walls. And eventually a male staff comes in to try to restrain her. Well, this exacerbated the situation for her. So yes, she's flailing and makes contact with that staff member. Person wasn't injured seriously. I don't even know if that person suffered a bruise. However, if this bill were to pass, that would be considered a simple assault that could result in an arrest without a warrant and and diversion from treatment to court and to jail and all of it. Another woman we heard about a lot, someone who there's an IEA in place. It had been granted. She'd been waiting, boarding for about a week, and involuntary medication was authorized. The medication is delivered intravenously. And so this person called us to report that in administering that medication, what the nurse did was rip her, bottoms off and shove the needle into her leg. Well, her reflex of action in that instance, she didn't want the medication. Again, flail. This is how someone could get hit. And again, that would be a simple assault, assuming the person didn't suffer a serious injury, could result in a warrantless arrest, interruption of treatment, transfer to a jail, transfer to court. We hear, repeatedly, we've heard about things like people who are IEA'd boarding, experiencing a crisis, hearing voices, not getting treatment, pacing, and so that we've heard about people banging their heads against walls, punching walls. If a staff member were to intervene to try to prevent them from hurting themselves, that's well intentioned. I mean, you don't want the patient to hurt themselves, but if they get in between the patient's head and the wall and get bashed by the patient, again, maybe the person doesn't suffer a serious injury. Do we want that person carted away to to a jail, to a judge, to a court system, when really what they need is treatment? These are the kinds of things that we hear about and that are really concerning to us, because in each of these instances that I've described, those patients were, if they were, I'm not aware that they were even arrested, but if there was a need to arrest them, they could be arrested, just not without a warrant, and their treatment wouldn't have been interrupted. Putting this aside, however, the other thing that this bill does, as amended, is that it deputizes people who work in healthcare situations to physically detain their patients, even if those patients aren't necessarily presenting a danger. And this is very concerning. One, I think my colleague from the ACLU, Gilles Bissonnette, provided you with an excerpt or maybe even the whole report that the study committee came out with. And one of their primary findings was that really de-escalation is paramount in terms of managing escalated behaviors. And so doing anything to encourage healthcare workers to physically detain someone beyond the time when they present an emergency or pose a risk of bodily harm to themselves or others, it's only going to escalate the situation. It's not going to de-escalate the situation. And so it thereby would then put healthcare workers in peril. It also could implicate federal regulation and our state law. And so that's what I handed out to you. So with respect to hospitals, the Centers for Medicare and Medicaid Services, CMS, has a regulation that provides conditions for approval to receive Medicare and Medicaid payments. And so I've provided that to you. And if you look at, and that's 42 CFR 482.13. On page 2 of the document I gave you, it's highlighted. It provides restraint or seclusion may only be imposed to ensure the immediate physical safety of the patient, a staff member, or others, and must be discontinued at the earliest possible time. So if hospital personnel were to literally hold on to someone who they suspected may have engaged in a simple assault, something that would justify a warrantless arrest under this bill, and wait for a police officer to come, and the person's calm, that could implicate their ability to secure federal Medicaid and Medicare reimbursement, something that's really important, obviously, to the financial stability of our healthcare institutions. Now, it should be noted that restraint and seclusion are permitted when the patient does present a risk of serious bodily harm. So it's not that they can't do that already. They have the tools, they can do that. But it needs to be stopped as soon as that person no longer presents a risk. And we don't want, I think, passing a law that would basically incentivize in some way holding a patient until they can be arrested without a warrant is ill-advised. I also want to turn your attention to New Hampshire's Patient's Bill of Rights. So I provided you with a copy of that. And if you go to page 2, I've highlighted the portion on patients' rights with regard to restraint and seclusion. Again, similar to the federal law. Now, the federal law that I provided only applies to hospitals. New Hampshire's Patient's Bill of Rights applies to all healthcare facilities, not just hospitals. And what this provides is that patients are supposed to be free from chemical and physical restraint except when they're authorized in writing by a physician. Now, that can be a retroactive authorization, just to be clear, but only for a specific limited time necessary to protect the patient or others from injury. Again, once the risk is no longer present, those efforts need to cease. Failure to do so is a violation of the patient's rights under this law, which are enforceable in our courts. So I also provided you with the last page of that document. RSA 15130 is the section of our law that provides that there is a right to equitable relief and damages for violations of our Patient's Bill of Rights. encouraging healthcare workers to hold on to someone longer than necessary potentially puts them in a situation where they could run afoul of a patient's rights under our Patient's Bill of Rights. So for all these reasons, I think that this effort is really not advisable. Our office also worked with the stakeholders, the law enforcement, ACLU, NAMI New Hampshire, Hospital Association on the bill as it was introduced, originally. And we were okay with it because what it did was it made it clear that we're talking about the use of warrantless arrest. The concept of warrantless arrest is in situations where there's some exigency. Never say that word. And it's really to say in a misdemeanor kind of situation, this is what we're talking about, misdemeanors, that where there's a likelihood that the person's going to flee, they're going to destroy evidence, or as introduced in this bill, they're going to interfere with the medically necessary treatment of themselves or others. That's the kind of exception that GRC could be okay with. But as written now, there's none of that protection. We're deputizing healthcare personnel to exceed what they're permitted to do under our state and federal regulations in some instances. And I don't think this is the solution to protect our healthcare workforce. I'm happy to take any questions.
Representative Prue.
They waited till. Never mind. Go skip.
Any further questions? No further questions from the committee? You sure you ain't got that one? Okay. Thank you for your testimony.
Thank you.
Chair calls Mr. Gary Apfel.
Good morning, Mr. Chairman, members of the committee. My name is Gary Apfel. I'm a lawyer practicing in private practice in Lebanon, New Hampshire. I am a member of the board of directors of the New Hampshire Association of Criminal Defense Lawyers, and I appear representing the association. Preliminarily, I would say that I know that I'm in trouble when I'm on the same side of a bill as the law enforcement officer who's testified before me. So I say that somewhat in jest. This statute is well intentioned, but and I've been listening to the testimony this morning, it does not achieve the result that the Senate sought, and it creates a host of new problems that I want to bring to your attention. So I'd ask you to envision the following situation under the statute as it's proposed to you. So a husband and wife are in a hospital, in the hallway, they're arguing. A licensed nursing assistant overhears and approaches. The LNA doesn't know what the argument was about. The LNA does not interview the husband. He knows nothing about the credibility of either party. The wife says only, I was threatened by my husband before you showed up. And the LNA doesn't investigate whether or not the wife has a motive to make a false accusation. And then he arrests and physically detains the husband. Under the statute as proposed, that would be legal. It wouldn't be constitutional, as I'll talk about in a minute, but it would be legal under the statute. What this bill does is that it grants powers of arrest that are denied to law enforcement officers pursuant to RSA 594.10. I'd ask you to look at that statute as you're considering your deliberations. I suspect that Representative Prue in particular will have questions for me about that, and I hope to be able to address them. It also, if you look at 594.10, it doesn't say that a warrantless arrest is okay by a law enforcement officer for a criminal threatening case. I think you just heard Attorney Rosenwald talk about exigent circumstances, and that's important. The other thing is, if you look at our warrantless arrest statute, it requires probable cause. which this detainment statute does not require. It only requires what we would technically use in the criminal justice world is a term of reasonable suspicion. And with all respect to Mr. Bissonnette, and I mentioned this to him when he finished testifying, and he asked me to clarify or explain when I testified. There's a huge difference between reasonable suspicion and probable cause. So what the founders of our country in general and here in New Hampshire in particular were worried about was that in colonial days that the king and his men could arrest people and search them or their possessions without a warrant and without justification. So in both the state constitution and in the federal constitution, we have requirements of a warrant and a probable cause determination made by a neutral individual, somebody who's not involved in the situation. And that was to protect people from being hauled off to jail when there wasn't really just cause to do that. There had to be some stopgap there. It's just like we have grand juries here in New Hampshire because we don't want people forced to go to trial on a felony when it's totally baseless. We have some various protections for that. Now, obviously, there are times when it doesn't make sense to make someone wait and go and get a warrant. That's exigent circumstances. And we already have in 594.10 an example of that, which is a domestic violence situation within 12 hours of when the act happened. And you certainly could, as a legislature, put in that statute a similar provision allowing for warrantless arrest under certain circumstances for things that are happening in hospitals. The statute here doesn't do that. Indeed, as it's written, the healthcare provider can detain someone and then the officer still would not have authority under the statute to arrest that person without a warrant. So it doesn't achieve what it is that folks, I think, are trying to get to here, which is the very real need that we need to protect our healthcare providers. But this statute simply doesn't do that. It doesn't prevent people from being charged from crime still, if it's appropriate to charge them, and it doesn't allow for their detention any quicker, ultimately by a law enforcement officer. So we need to ask ourselves, what are we doing here? I would also note that while I hear from the testimony today that healthcare providers are getting more training than may have been true in the past, it is inconceivable to me, as someone who works with police officers and with staff at the House of Correction at the prison day in and day out, that they have anywhere near the same level of training and experience as law enforcement officers. Those officers receive extensive training before being allowed to make arrests of any sort. As you heard from Superintendent Henry, they train for months at the police academy. They work with field training officers. They have ongoing training and refresher courses. Law enforcement officers also receive another type of training that healthcare professionals do not receive. They are trained in investigation and to make no arrest decisions. That includes factual investigation. That includes credibility determinations. That includes training in substantive law. It includes far more extensive training in appropriate use and levels of force. And I suspect that even with current training, that it includes much more training about de-escalation of potential violence. What this bill does, and it's not its intent, but it legalizes vigilantism. It encourages spur-of-the-moment decision-making by non-professionals, and I mean professionals in the sense of criminal justice system, they're obviously professionals in the realm of providing health care. And it allows the use of physical force without any required training, at least under the language of the statute. The bill also invites potential violence. Individuals, and I'm talking about patients or family members or other people who are in hospitals, inevitably will not recognize the arrest powers of healthcare providers. Some authorized detainers, any of these healthcare providers, may use excessive force because, again, they won't have the same training and understand what that is. Some authorized detainers may use or threaten the use of weapons. and some individuals will seek and receive aid from others to prevent detention. You need only look at recent history of the terrible results under somewhat similar circumstances around this country about citizens who are making law enforcement decisions on their own. Just in the past week, there was a shooting of a 16-year-old, Ralph Yarl, but an 84-year-old homeowner. The homeowner was clearly fearful for his own safety. Whether that was justified or not, the court system will need to decide. But it was reinforced by a law in Missouri that is basically a stand your ground statute. If you look what happened in Georgia a couple years ago with the murder of Ahmaud Arbery, that was a runner who was killed by men trying to stop someone who they believed was engaged in burglarizing homes. If you look what happened in Florida with Trayvon Martin, he was killed at the hands of a zealous neighborhood watchman. The workplace violence that has been talked about today is a huge problem. And I'm as much supportive of our healthcare professionals receiving the support they need. I also, sometimes in my primary work is doing criminal defense work, but in my 34 years of practice, I've represented victims of crime. I've represented mentally ill people. I represented Jane Doe before the New Hampshire Supreme Court last year with the involuntary emergency admission case where she was illegally detained at Dartmouth-Hitchcock for 21 days and only released because I filed a habeas corpus petition in the Grafton County Superior Court, or not released, but then sent to the New Hampshire hospital where they then had to go to court again to get her out. So I'm really sensitive to the needs of victims. I'm sensitive to the needs of mentally ill people. I know that when I was, for 6 years, a member of the board of directors of the Disability Rights Center, we were addressing these sorts of concerns as well. And we need our healthcare providers to be safe, but this doesn't make them safe. It is unfortunately a feel-good statute that is not going to de-escalate the level of violence in a society that is far too drawn to violence and anger. And it's only going to make us less safe. It's non-constitutional. And as the language is written down now, it will surely be struck down by the Supreme Court. At this point, I would stop and address any questions you might have, including if you want, I don't want to go too much longer. I'm happy to explain more about the difference between reasonable suspicion and probable cause if you want me to elaborate.
I think the committee's pretty aware of that. Representative Wheeler.
Thank you, Mr. Chairman. I just wanted you to, I wrote it down here, but I'm not sure I got it right. Is the statute that you referenced at the beginning of your testimony 594:10?
That is correct.
Thank you.
Representative Newman.
I just want to clarify, people mentioned the bill. And so we have a bill that was the original bill, and then we have a bill that was amended by as amended by the Senate, and then we have a bill to be amended by a proposed amendment that would take it back to the exact original language of the bill. Which of those bills are you for or against? Or both?
Yeah, I'm afraid I have egg on my face. The only version of the bill I'm aware of is the one that was on the table this morning, and that's the one that, when I became aware of it last week, that I made the decision to come here and testify. So that language is, it's really in section 3, and it's an amendment to the detainment statute, 627-8A.
Follow
So,
just to clarify, you don't have the other information then, so we'll have to straighten that out and figure out which this is. Thank you very
I
much.
don't, and I apologize for that,
No,
but is the
that's-
language now, just to be clear, that I'm
Right.
referring to is about healthcare providers or their agents being authorized to
Right.
detain people?
Thank you very
So-
much.
Yes, and that situation as well, but I don't see that as in bolded language. Was that already the law? No, okay, so,
It's something else.
yeah, okay.
Or it's a different statute. Representative Mannion.
Thank you, Mr. Chairman, and thank you for taking my question. I just want to ask you a question about your earlier testimony about the LNA scenario with the husband and wife in the hallway. And as I'm reading this bill, it specifically says against a healthcare provider or a patient actively receiving treatment by a healthcare provider. So that scenario would not happen. That LNA would not be justified in taking any action Am I correct?
I respectfully disagree. So someone comes in, they're initially screened, they're told to wait so they can get further care, and they get in an argument while they're waiting. That clearly would be within the grounds of the statute, and certainly I know prosecutors who would charge that.
Thank you. Did you have a question?
Oh, sure. Yeah,
A question.
I've been waiting.
So, do you actually think that LNA has the time to care about what that husband and wife are arguing? And first of all, they don't have arrest powers, right? Unless they're being attacked, as far as I can read through this.
Well, so I think there's two parts to that question. So the first is that do I think that an LNA has time? Right? And I would address that two ways. I certainly think that some people do not, but I do think that others do. And if there's a loud verbal argument going on in a hallway and the first person on the scene happens to be an LNA, that person might get involved. And I've certainly had cases in my experience where people are good Samaritans and trying to do what they can to be involved. So I think that that's possible. And more importantly, you as a committee and the House as a legislative body needs to be concerned about what statutes authorize, not just what is likely to happen most of the time. So you should consider tightening up the language because as it reads now, it's too broad and it invites those sorts of things. The second thing I would say is that we can quibble about words about detention versus arrest. But what we're talking about, and if you look at both the United States Supreme Court and the New Hampshire Supreme Court's law on the law of seizure, because we make all these fine line distinctions between seizure and formal arrest. The point is it's a restriction on someone's movement, so that person's not free to leave. And that has constitutional implications. And it needs to for all of us as citizens, because we normally assume that we can go about in our own way and do what we want to do. And now we're saying that somebody else, without personal knowledge, because that's the way the statute reads, without personal knowledge, can come and without doing a full investigation and without training, detain someone and prevent them from doing anything till a police officer arrives, at which point the police officer won't have statutory authority and will need to release the person. That's crazy.
In your opinion, if this were to pass as written, would not the employees at that point become agents of the state?
I do think that's what happens, yes.
And would then liability incur on behalf of the state, or how do you see that would play out?
So I think that I'm way over my element to talk about liability. I have never brought a lawsuit and I've never recovered $1 in damages from anyone. So because I was a public defender for 14 years and what I do now, and I about liability principles, I don't know. I do think that.
Well, let me interrupt you. I'm thinking more along the lines of liability. In other words, if a police officer injures somebody in the course of doing their duty, they're indemnified as long as it was in good faith for the most part. Whereas these folks injure somebody, are they criminally liable? I mean, are they exempt from the criminal laws at that point?
Well, it's going to come down to, as the language is put, whether or not their action was reasonable, right? So I certainly think you're going to see litigation. And it
And
might
a
depend-
reasonable police officer or a reasonable hospital? I mean, what's the standard that would be? That raises a whole new area of law, does it not?
Absolutely, because the statute doesn't define that at present. I mean, the proposed language doesn't define that. It just uses the word reasonable. And the reason I think it's important. I mean, what you're saying is key. The reasonableness language, which I presume was taken from the store owner holding someone for shoplifting. But that language is I'm pretty sure drawn from a U.S. Supreme Court case, Terry versus Ohio, about when a police officer can have an interaction with someone that's short of a full arrest. I think that's different from talking about reasonableness in the context of self-defense. So even though it's the same word in the English language, it comes from different bodies of law, and as presently, it's a mess.
Seeing no further questions, thank you for your testimony.
Thank you very much.
Is there anyone else who has not testified in this bill who would like to testify? Seeing none, I hereby close the public hearing. The committee will be in recess until 12 o'clock, when we will take up the executive sessions that are scheduled.
And you're welcome. I didn't ask all the questions I wanted to. Oh, listen, my tongue is bleeding so bad, I need stitches.
I hate to see people get hurt. I know you were struggling.
Yeah, I was.
you know, and the emotional toll. And now as I think about sending my child off to college, the all of the normal anxieties as a parent of sending your kid away to be with someone else are so much more exacerbated by just the implications of all of this. And so I support the motion.
Thank you. Representative Murphy.
Thank you, Mr. Chair. I too am in full support of a felony. As we know, not only are our first responders put at risk in situations like this, but emergency calls that come in that those emergency responders cannot respond to. That, you know, it really, we're looking at so many lives that are impacted, and I think some of the examples people gave here certainly speak to it. So absolutely in full support.
Representative, I'm sorry, I don't see your name tag, but Rassin.
Thank you, Mr. Chairman. I just wanted to relate a little story. I worked in special education for 10 years in the Rochester school system, and I worked with a number of autistic children. And when I started there, active shooter drills were not a regular thing. But I'll tell you, when I was in a room with a single child, with a room that did not have a door in it, but we had a closet in the room, and there was an active shooter drill gets called off. It's much different than a fire alarm. You know, we were having our fire drills or fire alarm, you walk the children out very easily. When I have to take a child who was severely autistic and put him into a dark closet, very confining closet, and basically hold him in a bear hug so that his screams can't be heard, that is traumatic to that child. This is not a victimless crime. Even the drills are criminal, that what we do to these children. When I got him out of that closet after just 15 minutes in there, the rest of the day was impossible. His parents worked, so we couldn't send him home, but it was just nothing to do. The kid was hysterical for the rest of the day. And that was just one child. I know a number of other children in similar situations throughout the state who go through the same thing every time we have active shooter drills alone. And people have to understand this is a serious crime, and I will be supporting it. Thank you.
Thank you. Representative Mangiapudi.
Thank you, Mr. Chair. For me, it's personal in terms of my husband is a public school teacher, and this is his second career. And every time I hear a false alarm, and my first immediate response is to pray, and I hope I see him alive, coming back. And for him, it is more, how do we save the students? I don't have the ability to save my students. And whenever it's a false or not, and the health toll it takes on the teachers and the students is immense. And it's long-lasting changes. So I would be 100% behind it.
Thank you. Any further? Representative Prue?
I know from the first responder as a firefighter EMT, when we're responding to these things, we jump it up to a higher level because children are obviously involved and maybe take chances that we probably normally wouldn't to get there. And our job is now to go in with the police as well. So it's a whole different level. We're in a whole different mindset, and it's happening way too often, and there needs to definitely be some kind of deterrent to put an end to this.
Thank you. Representative Wheeler.
Thank you, Mr. Chairman. It's personal for me as well. Pretty sure I'm the only person on this committee who was just in high school in these last 5 years, and I remember, and I remember very clearly, being in middle school and these drills getting exponentially more common as I was in school. And we had many false reports in Conval when I was in school. It happens a decent amount, not to this level all the time, but this level does happen. We just saw it in Portsmouth. We just saw it in our state. And I just remember, as Representative Grassi said, how scary the drills themselves were. Some of my friends worrying about whether or not they get stuck in the bathroom or get stuck in the hallway, and that's a reality that kids who are educating should not have to face. And I'm not a supporter of felonies or increasing charges too often, but this is a case in which I really do feel that we need to. I've gone through it far too much, And I think that making a statement that this is a felonious crime is the right thing that the state should be doing, and I urge you all to support it.
Representative Muse.
Thank you, Mr. Chair. I'm going to support the motion because this is not a victimless crime. This is an act of terrorism, and it's separate and distinct, I think, from a genuine threat. What we had in Portsmouth last week was a young man who made threats on social media. Police investigated and found that those threats were borne out. He had the weaponry and the ammunition in hand to carry them out. We're not talking about that here. What we're talking about here is the worst kind of swatting. These are people who, for one reason or another, decide that it's fun or it's some kind of a game to call police departments and report an active shooter. And one of the things I just think we've all seen from all of the news reports, from all of the recent incidents, both real and false, is how this entire situation not only wears on teachers and students and parents, but also how it wears on police officers who have to respond. And I think one of the things we're basically kind of coming to is almost like a societal PTSD around incidents like this. So I think passing a bill like this sends a message to people who would try this or attempt it, that this is something we're going to take seriously. This isn't just a 17-year-old pulling a false fire alarm outside the boys' room in high school. This is a crime. This is an act of terrorism, and we're going to treat it like one. Thank you.
Thank you. And I'm heartened to hear the bipartisan testimony in support of this bill. I'm hoping that this committee will speak with one voice and we will unanimously send this to the floor. And this committee and therefore this state will be indicating that we will not tolerate this kind of behavior. With that, I would ask the temporary clerk and minority leader to call the roll.
Yes.
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 Yes. Yes.
Yes.
Yes. Yes.
Yes.
Yes.
Yes.
Yes.
Yes.
Yes.
Yes.
Yes.
Yay.
Chair votes yes. The motion about to pass passes unanimously, 20-0. Any objection to consent? Seeing none, the bill will go on consent. And with that, I close the executive session on SB 244. I open the executive session on SB 252 relative to defendants pending trial release. This is the bail bill. I'm going to start by saying, at the beginning of this session, when I saw that we had a lot of these bail bills coming in from different sides of the aisle, a lot of different suggestions, I realized that it was going to take a little bit more work than just patchwork bills. So I made a commitment to this committee and to the public at large that I would retain all those bills and we would work on them over the summer in a bipartisan fashion to come up with something that we all could agree on. And I intend to maintain that commitment. So therefore, on House Bill 252, I make a motion to retain. Do I hear a second?
Second.
Seconded by Representative Gathright. I'll just quickly add on to what I just said when I speak to the motion. We have, I believe, 4 or 5 different bail bills dealing with different parts of the law, dealing with different issues in the law, and we need to look at those and look what's really going on, not take anecdotes, not take panic measures on it. We need to have level and cool heads when we look at it. As start of the process of looking into it, the first thing I discovered that is causing some of the problem is that police departments in different parts of the states have no way of knowing whether somebody's already on bail. So a lot of times the bail commissioners are getting a bad rap saying, why are you letting people out who are already on bail? Well, frankly, we discovered there's no way for them to know they were already on bail. There's no interconnection between them. It's a paper system. So I was able to, just under the wire, get the state police to get me an estimate from their vendors, and I was able to get $1 million into the budget to fix that problem this year. So that's the first step that we're taking. And I'm hopeful this summer the subcommittee will come together and we will come up with a good piece of legislation to fix anything else that we deem needs repairing. Representative Gathright, would you like to speak to your second? Any discussion on the retention? Seeing none, I'll ask Representative Muse.
I just wanted to say that I appreciate the chair's efforts adding the money to the budget to actually address a systemic communication problem between our court system and our police is actually a great example of the kind of things that we need to be doing. We have systemic issues with the judicial system that are manifesting themselves as a lot of the cases that are coming up in anecdotes. And I think as we hear testimony, we've heard that we don't have enough prosecutors. The prosecutors we do have often don't have enough time to track these cases in court. We hear there are issues with bail commissioners not being properly trained. We hear that magistrates might be a solution, that more judges may be a solution. I think the one thing that's become really apparent to us is that making reflexive decisions on bills that are very narrowly focused in this area, especially right now, isn't going to serve us particularly well. So I know I welcome the opportunity to really take a look at this from a broader, more systemic perspective, and to do it over the summer, knowing that we actually have a deadline to get something done, and that we need to act on these bills. But I appreciate the opportunity to do it in a considered way where we're going to be able to have the ongoing opportunity to get additional input from stakeholders throughout the process, to be able to test ideas with each other and with different people. I just think that way we wind up with better laws, and it puts us in a better position to fulfill our responsibilities to the people of New Hampshire, to not only to keep everybody safe, but to make sure that everybody's constitutional rights are respected. So again, I appreciate the retained motion, and I intend to vote for it. Thank you.
Thank you, Representative. Representative Newman.
Thank you, Mr. Chair, and I also want to thank the chair for appropriating money for a data system, because I think it's very important that whoever it is that makes the decision on whether to grant bail or not, whether it's a judge or the bail commissioner or a magistrate or whoever it is, has the appropriate information in front of them so that they can make an appropriate decision based upon what the true facts are. Thank you.
Seeing no one else, I'd ask the clerk to call the roll.
Yes.
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 Yes. Yes.
Yes.
Yes.
Yes.
Yes. Yes.
Yes.
Yes. Yes.
Yes.
Yes.
Yes.
Yes.
Yay.
Chair votes yes. The motion to retain passes. The bill is retained. I hereby close the executive session on, I forgot what number this is. SB 252. So for the committee, SB 58, the subcommittee is the last bill we have to act on, except for, oh, what's that? Oh, I do have one more. We have to, don't really go anywhere. The last bill we have to act on that's still in play after today. I'm about to open executive session on SB 76 for like the 5th time, I think. I'm going to reopen it because it was in recess. So as I said, 58 will be the last one until, that'll be it for our work for the summer, except for subcommittee work. So the sooner we get 58 done, the sooner we're out of here for the break. So at this point, I'll open the executive session on SB 76 and recognize Representative Wheeler to make a motion.
Thank you, Mr. Chairman. I motion OTPA on SB 76.
Second, and I believe Representative Wheeler is making a motion of ought to pass and offering amendment
Thank you. Thank you, Representative Rhodes. I'm still a freshman, folks. No.
2023-1432H.
Thank you. Would you like to speak to your motion, Representative?
Freshman at a high school, right as like Mannion said, actually. I am a freshman at a high school. That's right. Yes, Mr. Chairman. So SB 76, we've done this 5 times because there was a little bit of confusion from the public testimony that was given. People were talking about 2 different statutes. The statute in here, right as it stands, is an amendment to RSA 644:7, which amends the abuse of the corpse statute and includes failure to report the death of an individual or finding a corpse to law enforcement or unlawfully removing, concealing, or destroying the corpse. So this is the bill as it should have been and includes Maryland's law, which is the name request that was given to us by the woman who was testifying for her grandmother whose death wasn't reported by the son. So no further comment other than that.
Thank you. Representative Rhodes, would you like to speak to your second?
Thank you, Mr. Chair. Representative Wheeler did a fantastic job. And just to clarify any confusion that may exist, we had to recess the last bill because we actually had 2 different amendments, which we weren't able to do. And then we also discovered that it was unfortunate the wording that we had was actually making it where if a loved one witnessed a family member, say, die in a hospital, they actually would have been guilty of a crime had they chosen to call a family member before reporting it either to someone in the hospital or to a police officer. So we fixed all that and we kept it simple. And I believe that this is great the way that it is. So I would ask everybody to please support it.
I would ask everyone to support it too, because if I never see this bill again, it will be too soon.
Are there, I didn't receive a copy of the new amendment. Did they come around?
It went around somewhere.
I didn't get it. Oh, okay. Thank you.
That's all right. Any further discussion on the bill? Again? No? Okay.
Guilty.
Okay, so the motion now is to ought to pass as amended. And, yes, sir. Yeah, we do. So actually, you're right. The motion is to adopt amendment number 2023, 1432. And this vote right now is to adopt the amendment. And I would ask the clerk to call the roll if she's ready.
Yes.
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 Yes. Yes.
Yes.
Yes.
Yes.
Yes. Yes.
Yes.
Yes.
Yes.
Yes.
Yes.
Yes. Yes.
Yay.
Chair votes yes. The motion is adopted unanimously. Now it's open for further motion. Representative Wheeler, do I hear a further motion?
Yes, Mr. Chairman. Now I make a motion to ought to pass with amendment on SB 76. as amended on SB 76.
And-
Thank you, Representative.
Second.
Second. I think we've had enough discussion. Would anyone want to talk about it? No, I didn't think so. Wait a minute. No, you sure? Okay. Oh, okay. Seeing no further discussion, I would ask the clerk to call the roll. This is now ought to pass with amendment or as amended or whatever he said.
That's what's best as amended. Yes.
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 Even with the name.
Yes.
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 Yes. Yes.
Yes.
Yes. Yes.
Yes.
Oh, it's actually Hack and Phillips today, I think. It's okay. I vote yes.
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 Yay.
Chair votes yes. This bill, thank God, is passed unanimously. Any objection to consent? Seeing none, it's on consent. Executive session's closed. And we are complete for the day. What's that? No. Hopefully there won't be one. So we're done. You'll hear from me on the next hearing date. I'm going to do that, man. You'll also watch your email in the next week. I'm going to assign subcommittees to all the retained bills for the summer. There's a certain date the speaker will let you know when you can begin to work on retained bills. You can't do it right away. So I'll let you know when you can start. I believe it's, what is it, like August? Something like that. Yeah. You'll have from August to the end of September. But I will.
He gives us the summer off.
Yeah, he does. Yeah, thank God. Representative Rhodes wanted to address something.
Yes. Thank you, Mr. Chairman. I would just like to take a few moments to address our bill that we have, the menstruation bill that we testified in front of the Senate. So during that testimony, Representative Reed and I had the opportunity to testify together as a team. And the version that we have that unfortunately came out of here without a recommendation, I would like for everybody to take a look at that. And there's actually a couple of flaws that are in there that weren't even discovered when we were here. It was after the fact. That is actually making it where we really can't actually pass it even on the floor. Is there some grammatical errors, and one of them is it references the superintendent as being in charge of the county, the state, and of the juvenile detention center. So that is something. And another thing that has come up that is not any of our faults, but we did not specifically put a number, and we were asked to do that for our version, which we did. And now apparently the other body doesn't seem to think that they want the number in there. So good luck to us on the floor.
Okay, so the version we passed out of here without recommendation is still in play, if I'm not mistaken. And we may need to do a floor amendment and see if we can come together on it, because the Senate version looks like it might go down in flames.
I think they're going to amend it again.
I don't know. Just at the end of the day, I want to make sure we get a piece of legislation out to help those people, because that's what was going on is horrific. So
Representative Janvrin, there had better not be a better conference on this bill. It's not necessary. It's really, the whole thing is just far more complicated than it needs to be. We address the issues. The bill we have is great.
I can't remember. Do you remember the bill number?
No.
All right. Well, I'll email the committee both numbers so you can review them both, the House and the Senate version, and we'll figure it out.
We did make the amendment as requested.
That was a female province.
Yeah.
We made the amendment and we presented it with the amendment. So we'll see what they do.
All right. With that, we're done for the day, and watch your emails. I'll let you know when we need to come back. Thank you. Enjoy your vacations.